This is the first of two videos on hazardous materials. The first one is about HAZMAT, which is Hazardous Material and Waste Management Program. The second one will be on HAZCOM, which is Hazardous Communications. For more videos, visit my Facebook page, Healthcare Quality. What's hazardous material and hazardous waste? These are materials whose physical, chemical, or biological characteristics may pose a risk to staff, patients, visitors, facilities, or the environment if spilled or released in uncontrolled manner. Generally, a material or waste is classified as hazardous if it presents a physical or health hazard, or if it contains more than 1% of a hazardous material or more than 0.01% of a carcinogen. The World Health Organization identifies hazardous materials and waste by the following categories: infectious, pathological and anatomical, pharmaceutical, chemical, heavy metals, pressurized containers, sharps, genotoxic or cytotoxic, and radioactive. But remember, not every hazardous material is a hazardous waste. The Hazardous Material Waste Management Program provides a framework for managing hazardous materials and waste, while the Hazard Communication Program, which is a key element of the Hazardous Material Waste Management Program, trains and educates workers on the identification, use, and storage of chemicals. Health hazards can be identified via inherent ability, toxicity, or probability to cause harm or damage. Effects can be either acute, chronic, or both. We have four different types of health hazards, which are chemical, biological, physical, and ergonomics. Health hazards can enter our bodies via inhalation, skin absorption, ingestion, or injection. In the evaluation of health hazards, we define the chemical state and technical data through MSDS, how chemical is used, and industrial health sampling. We deal with biological hazards in airborne infection isolation, operating rooms and hydrotherapy, controlled environments. Don't underestimate housekeeping rule when it comes to infection control and cleaning blood spills. Physical hazards are those substances which threaten your physical safety. The most common types of physical hazards are fire, explosion, and chemical reactivity. Here are the most commonly used hazard symbols. We have three classes of materials which use the fire simple. Number 1, flammables. Can be gases, liquids, or solids. Flammables ignite easily and burn rapidly. Liquid flammables have a flash point under 100 degrees Fahrenheit. Number 2, combustibles are similar to flammables, but they don't ignite as easily. Liquid combustibles have a flash point above 100 degrees Fahrenheit. Number 3, pyrophoric or spontaneous combustion materials burst into flames on their own at temperatures below 130 degrees Fahrenheit. Materials that use the flaming O symbol are divided into number 1, oxidizers, which cause other substances to burn more easily through a chemical reaction or change. Number 2, organic peroxides that contain oxygen and act as powerful oxidizers. Materials that use the explosive symbol. Number 1, explosives, which release a tremendous amount of energy in the form of heat, light, and expanding pressure within a very short period of time. Number 2, water reactive, that reacts with water and may explode, or they may release a gas which is flammable. Number 3, unstable reactive, that can react or can become a self-reactive when subject to shock, pressure, or temperature. Many gases are used in healthcare process. In order to transport, store, and use these gases, they are bottled under great pressure in tanks called gas cylinders. Here are some signs used when we deal with hazardous materials with their characteristic colors. We have two types of labeling in hazardous material program. The manufacturer labels and NFPA labels. In each department, there should be someone responsible for labeling of hazardous materials. In the manufacturer's labels, we usually have the name and address of the manufacturer, product name, physical warnings, and health hazard warnings including target organs. The second type of labeling is the NFPA diamond, which consists of 4 colors: blue for health, red for flammability, yellow for instability, and white for special hazard information. For each class of hazard, we have 5 degrees of severity: 0, no hazard; 1, slight hazard; 2, moderate hazard; 3, severe hazard; and 4, deadly hazard. Here is a detailed description of degrees of severity. And here is a summary of NFPA system of labeling. Storage of hazardous chemicals. Purchase only quantities that can be used in a reasonably short time. Limit amounts kept in labs or work areas. Store according to chemical classification. Don't store alphabetically. Store close to floor rather than above head level. If stored on open shelves, keep to rear rather than on front edge. Don't store inside hoods. If not being used, get rid of it. All chemicals should be dated when received and again when opened. Flammable materials in containers larger than 1 gallon should be stored in approved flammable material storage cabinet. Acids and bases shall not be stored with flammable materials in flammable cabinets. Acids should be segregated from bases. A sufficient supply of absorbent and neutralizers should be available at all chemical storage locations for use in the event of a spill. Compressed gas cylinders should be chained, as we will explain in detail later. Transportation of hazardous chemicals. All hazardous material shall be transported within secondary containment of sufficient size to hold the entire contents in the event of spill or leak. No need to label it if used immediately by one person, but must be labeled if used by more than one person or used or left for more than one shift. Large volumes or numerous bottles should be transported on carts with sides of sufficient height to restrain containers. The wheels of the cart should be of adequate diameter to assure smooth travel throughout the route of transport. At no time shall hazardous materials be left unattended during transport. Routes of transport for hazardous materials shall be planned to minimize exposure to personnel and patients in the event of spill. In the event of a spill of hazardous material, the procedure for spills found in this policy is to be followed. Chemicals can be safely used if you know the hazards and how to protect yourself. They are used only for approved purposes, and they are stored properly. You use the correct personal protective equipment. You don't eat in areas where chemicals are used, and you wash immediately if you come in contact with chemicals. You know where MSDS are located and how to use them. Ask your supervisor if you have questions. Only trained employees may use chemicals.
Now, let us talk in detail about handling compressed gases. When handling compressed gases, store them in a well-ventilated area. Keep it upright or standing, chained on the wall. One cylinder is the highest number that can be secured on a single chain or strap. The color of a compressed gas cylinder is not adequate identification of the contents of the cylinder. The name of the gas must be on the cylinder, and this must be checked prior to using the gas for a patient. Check the pressure in the cylinder using the built-in meter gauge attached to the tank itself. Use a checklist for this purpose. The expiration date must be checked prior to using the gas for a patient. When in use for healthcare, all compressed gas cylinders must be equipped with an appropriate approved regulatory device.
When small-size cylinders are used, they shall be attached to a cylinder stand or to a therapy apparatus of sufficient size to render the entire assembly stable. Cylinders shall not be chained to portable or movable apparatus such as beds. Flammable compressed gases shall be stored separately from oxidizing gases and must be stored in an approved storage area. Full and empty cylinders must be clearly identified as such. This is done in order to prevent delay in an emergency in determining whether tanks are full or empty.
Precautionary signs must be readable from a distance and shall be displayed on each door or gate of the storage room or enclosure. Storage locations containing medical gases other than oxygen and medical air shall have their doors labeled with a sign containing the following information. Storage locations containing only oxygen or medical air shall have their doors labeled with a sign containing the following information.
When a compressed gas cylinder is being transported on a slanted carriage, it must still be secured by a strap, chain, or other approved means.
In case of outside bulk compressed gas storage, security fence intact and entrance is locked. Signs prohibiting smoking within 25 feet of outdoor storage are posted and enforced. Hazardous waste handling and disposal. Materials in any of the following categories must be disposed of as hazardous materials. Category 1, ignitable. Any substance with a flash point below 60 degrees centigrade. Category 2, corrosive. Any substance with pH of less than or equal to 2 or greater than or equal to 12.5. Category 3, reactive. Any substance which is unstable, reacts violently with water, forms potentially explosive mixtures with water, generates toxic gases, vapors, or fumes when mixed with water, or exposed to a pH between 2 and 12.5, or capable of detonation or explosive decomposition or reaction. Category 4, toxic.
Stuff in areas that generate chemical and radioactive waste follow the procedure below. All waste is properly packaged for transport. All liquid waste must be in a chemically compatible container, sealed with a screw-on cap and free of any residue on the outer surface of the container. Don't put any waste in water bottles, milk jugs, or household detergent containers. All solid waste must be in an approved bag or box and seal tab. The bag or box should not be leaking or have any residue on the surface. Items containing lead are packaged separately from all waste. Waste containers are closed at all times except when adding waste. Waste is tagged for disposal with the appropriate tag.
Available tag types are as follows: chemical waste, radioactive waste solid, radioactive waste liquid, radioactive waste biowaste. Radioactive liquid waste requires both the radioactive waste liquid tag and the chemical waste tag. Chemical disposal. Recycle unused chemicals. Don't place hazardous chemicals in normal trash receptacles. Don't pour chemicals into sinks, onto the ground, or in storm drains.
Infectious waste include solid or liquid waste which contain pathogens with sufficient virulence and quantity such that exposure to the waste by a susceptible host could result in an infectious disease. Waste items that are considered infectious include but are not limited to needles and sharps, items contaminated with blood or body fluids, isolation room waste, all microbiological waste, anatomical waste, anatomical pathology, and surgical waste. The Infection Control Committee is responsible for the definition of infectious waste and is responsible for developing guidelines concerning the handling or disposal of infectious waste. Cytotoxic drugs. Staff who have regular contact with preparing, administering, removing, and destroying cytotoxic drugs are oriented to the hazards of handling them. Special instructions are given on the disposal of designated cytotoxic drug waste and the cleaning of areas where these medications are in use. Trace contaminated cytotoxic drug waste includes items used to prepare drugs, items used to clean areas and waste from patient rooms where drugs is administered, empty bags, vials, IV tubing, etc. These items are placed in a securely closed cytotoxic bucket or cytotoxic waste bag prior to transport. Cytotoxic waste is picked up by environmental service or other designated housekeeping service and transported to an offsite medical waste incinerator. Sharps may be discarded in cytotoxic waste. Unused IVs and vials of drugs are returned to the pharmacy for disposal. Cytotoxic waste containers are available on units for disposal of waste from patients receiving them. Staff must wear appropriate personal protective equipment. Controlling physical and health hazards. There are a number of ways that you can safeguard your health and physical safety when using hazardous materials. These measures include product substitution, engineering controls, administration, safe work practices, personal protective equipments, training and communication, environmental monitoring, and personal monitoring. For product substitution, because many chemicals do similar jobs, it's important to select chemicals that do a good job while being less toxic. For engineering controls, well-designated work areas minimize exposure to materials which are hazardous. For example, engineering control would include exhaust systems and wetting systems to control dust. Administration control include rotating personnel, limit time and unnecessary use of chemicals. Safe work practices will ensure that chemicals are used correctly and safely. Personal protective equipments might include dust masks and respirators, glasses, goggles and face shields, hearing protection, gloves, food protection, head protection, aprons or full body suits. Respirators must be approved and specific to the nature of hazard. For example, N95 for airborne infection isolation, used as last resort when 1 and 2 above are not feasible. When working with a hazardous material, the minimum personal protective equipment shall be lab coat or other protective clothing, safety glasses or splash goggles, and gloves. Personal protective equipment shall not be worn outside the lab or work area. Training and communication. The hazard communication written plan available through Environmental Health and Safety is not considered complete until supervisors will perform their responsibilities. Knowing how to work safely with chemicals that pose a hazard is an important activity. This is the reason for this training, bulletin boards, safety meetings, MSDS, and various bulletins. You have a right to know, but you also have a responsibility to use the knowledge and skills to work safely. Environmental monitoring. Industrial hygiene personnel regularly sample the air and collect other samples to ensure that hazardous chemicals do not exceed established acceptable exposure limits. Industrial hygiene is the art and science devoted to the identification, evaluation, and control of health hazards. It includes periodic surveys as well as chemical monitoring and engineering control evaluation. Industrial hygiene sampling instruments might include passive dosimeters and direct reading monitors. Personal monitoring. Monitor yourself and others. Be on the lookout for any physical symptoms which would indicate that you or your co-workers have been overexposed to any hazardous chemical. Symptoms such as skin rashes, dizziness, eye or throat irritations, or strong odors should be reported to your supervisor. Hazardous materials first aid. For eyes, flush with water for 15 minutes. For skin, wash with soap and water. For inhalation, move to fresh air. For swallowing, get emergency medical assistance. The first 10 to 15 seconds after exposure to a hazardous chemical are critical. Delaying treatment may cause serious injury. Emergency showers and eye wash stations provide on-the-spot decontamination. They allow workers to flush away hazardous chemicals that can cause injury. Emergency showers can also be used effectively in extinguishing clothing fires or for flushing contaminant of clothing. Ergonomics. Lift and carry safely. Check your route of travel. Get a good grip. Lift with your legs, not your back. Make sure you can see over the object you are carrying. Watch where you are going. For fall prevention, be careful on stairs. Use ladders safely. Replace fall protection chains or barriers. Use fall arrest equipment when required. We should also deal with office working risks. Thank you.